Assalamualaikum and good morning. Welcome to the Faculty of Medicine Research Carnival 2021. I am Dr. Sharifa Zamia, your host for today's session. On behalf of the Carnival community, I would like to thank every one of you for joining us today on Zoom and also on YouTube live stream. So before we get started, I would like to express my sincere appreciation for all of you who generously help us to make this event come together. The visibility team, the research office team, the IT, and staff from the Dean's office. This is the first online research carnival in this faculty, and this could not have happened without the help from all of you. The FOM Research Carnival annual event brings renowned speakers and experts from various backgrounds to discuss on a common theme. So as for 2021, the theme is patient and public involvement in education, advocacy, and research. The active involvement of patient and public in research, education, and advocacy are crucial. Not only it improves quality and relevance in these key aspects, but it also gives more impactful and targeted outcome to the stakeholders, which are the patients and also the public. So in this 4 days carnival, we have clinicians, scientists, NGO, academics, public, and patients, and they will be sharing their research, their experience on PPI. And we aim that this would encourage more PPI implementation in education, advocacy, and research in Malaysia, and it will start here in FOM. Since this is a carnival, it's going to be fun, chill, and we are going to be giving a lot of prizes away to our audience. So please, if you are on Zoom or you're on YouTube, go to the chat and click on the link to register yourself, and you'll be in for the raffle to win prizes. We have 2 winners for each and every session, and please tune in to our closing event so that you know who the winners are. So now, without further ado, let's start the event by welcoming address by our Deputy Dean of Research, Professor Sanjay Rampal. Prof, the spotlight is all yours.
Thank you very much. So, Selamat Sejahtera and good morning to everyone. I will start off with some welcoming remarks. So, I think the most important thing to note is that we all have weathered some difficult times over this ongoing pandemic. The management of the pandemic has exerted a heavy toll to healthcare professionals, the academic community, and the public. Much of society suffers from pandemic fatigue. Now, in all the negativity though, it is very positive to note that Faculty of Medicine, University of Malaya, has maintained its high standards of research despite these trying times. Our academicians and staff continue to produce high quality research output, and I think this is a reflection of their high dedication and motivation to improve the health of the nation. Now, just as a summary for 2021, as of 2021, as of last week, our academicians and staff have produced 569 publications, and Faculty of Medicine, University of Malaya, has received approximately 16 million ringgit in total grants. And of this allocation, 9 million has come from internal sources of the government, 3.5 million have come from national private grants, and approximately 4 million have come from international grants. In addition to this grant allocation, the faculty and staff of Faculty of Medicine have been very active, engaging national and international collaborators. As of today, there are a total of 39 active national and 179 international MOUs and MOAs. In 2021 alone, we have signed a total of 9 national and 33 international MOU and MOAs. Now, all these numbers and statistics are impressive, but this year's Research Carnival aims to go beyond the academic realm and explore the perspective of another very important stakeholder of research, the patients and the communities at large. Our yearly research carnival typically highlights the research by the faculty members. This year, the theme is Patients and Public Involvement in Education, Advocacy and Research. Hence, the theme is spot on and truly celebrates the matrimony of various parties with the involvement of patients and the public. We hope to transition to a more comprehensive research ecosystem. And we are aiming for a research journey that starts with the patient and the community, and one that ends benefiting the patient and the communities at large. Thank you very much.
Thank you, Professor Sanjay, for your welcoming remarks. Now, without further ado, we would like to invite the Dean of the Faculty of Medicine, Professor April Camila Rosali, to deliver the launching speech.
Thank you very much, Sharifa. Assalamualaikum and good day to all of you. It gives me great pleasure to welcome you to this year's University Malaya Faculty of Medicine Research Carnival. This carnival has taken place annually since 2013, in line with University Malaya's goals of highlighting the research achievements of its faculties, engaging stakeholders, and facilitating collaborations. Although the COVID-19 pandemic prevented us from organizing one last year, the silver lining was that we all became very familiar with innovative delivery of teaching and learning. And I am happy to see that we have reinvented the delivery of this carnival as a virtual one. Each research carnival has been thematic. The pandemic of the past year and a half has seen engagement between healthcare professionals, researchers, and the public elevated to new heights. Traditionally, patient and public involvement, or PPI, in research has been primarily with the patients as study subjects, with researchers and healthcare providers being the main drivers of the research process. However, for research to have outcomes that solve real-world problems, public and patient involvement is needed at all stages of the process, whether in setting priorities, planning and management, as well as summarizing, distributing, and implementing research results. In line with University Malaya's vision of impacting the world with a shift towards impact-oriented research, the Carnival has chosen the theme of patient and public involvement in education, advocacy, and research in order to highlight this complex ecosystem comprising the researchers and healthcare providers, NGOs, patients, and the public. Over the next few days, examples of successful PPI and research projects will be demonstrated, covering a wide range of health domains, including cancer survivorship, mental health issues, and research related to pediatric, geriatric, and disadvantaged populations. NGOs such as Yayasan Generasi Gemilang, Project Hans, Persatuan Insaf Murni Malaysia, and the National Stroke Association of Malaysia will give insights into their work. We are also fortunate to benefit from the experience of two inspiring plenary speakers. Professor Liu Su-mei is no stranger to local audiences as an exemplary researcher and advocate for primary care medicine based in Faculty of Medicine. While Professor Sir Terence Stephenson is not only a Nuffield Professor of Child Health, but has vast experience in developing policies regarding clinical services and research in the United Kingdom. I am sure that we have much to gain from the combined expertise of all our speakers, and I hope this will be a springboard for even more PPI initiatives in the future. May this be the start of an exciting and inspiring journey for all of you. With that, thank you very much.
Thank you so much, Prof. April, for launching the event. Indeed, we agree with Prof. April that PPI can be applied in various research from fundamental, applied, and clinical trials. So for this year's Research Carnival, we have our PPI star from University of Malaya, Faculty of Medicine, which is Professor Dr. Liu Siu Mei. So a little bit of a background about our PPI star is that Prof. Liu was funded by Ppi Fellowship and the National Institute of Health Research and UK8 to work on developing patient and public involvement in research in Malaysia settings. Professor Liu is a family medicine specialist at the Department of Primary Care Medicine, University of Malaya. She is also a senior fellow at the Center of Evidence-Based Medicine, Oxford University, and an honorary clinical epidemiologist for the National Clinical Research Center, Malaysia. Her career intentions are to develop further as a researcher and a leader in discipline of primary care medicine, especially with the focus on respiratory diseases. This area has been somewhat neglected in our region, and she hopes to be able to carry an impactful research which will improve patient care and control respiratory diseases. And her main aim is there is a true involvement in patients and public involvement in her research. However, due to inevitable and health circumstances, Prof. Liu are unable to join us today live. However, she has prepared her talk entitled, What is Patient and Public Involvement and Why It is Important? Please, audience out there, both on Zoom and also YouTube Live, do send us your questions. Do send your questions to us during the talk. And although Prof. Lee won't be here to answer the question live, but we will collect the question and revert back to all of you through our FOM Facebook page by this week. Right? So enjoy the talk from Prof. Liu.
Hello, I'm Professor Dr. Liu Sumi, and I'm here to talk to you about my experiences with patient and public involvement in research. I'm really sorry I can't be there with you all live. It is really something that I wanted to do, but I'm unable to be there. So I thought that I would share a recording of my talk so that you have an idea about what we did in our research and how the patient and public members really helped us in getting our project to the end. So let me start by sharing my screen. So my talk is about what is patient and public involvement in research and why is it important? Why should you listen to this talk? So again, I really wish that I could be there. I was supposed to be one of the chairs of the Faculty of Medicine Research Carnival, but I'm not on a holiday somewhere. I have a serious condition that was recently diagnosed. Here's a picture of me undergoing chemotherapy recently. And on next week, I will be having an operation. So the time of the Research Carnival and the talk will be during the time that I will be on leave. So trying to heal from the operation, I hope. And I again, my apologies for not being able to be there with all of you. But so when I was asked to give this talk, I thought it was really interesting. And because of the different roles that I play, who am I? I am a researcher. I am a teacher. Yeah, I teach. I am a doctor. I am a patient. And I am a member of my community. So I'm all these roles. And They're not listed in any order of importance. Every one is an important role, and plays a major part of my life. And so it's really interesting when the roles overlap. So as my recent medical issue, I have had as lupus since I was 24 years old. So that was more than 20 years ago. And I've always had this, sometimes the roles overlap, or that they actually, there's some conflict. I am often a doctor as well as a patient at the same time. And there are some things that I've learned from this, being a doctor as well as a patient. I've learned that many doctors don't actually listen to the patient, don't listen to me, even though I'm a doctor. And I've also learned that the process of care often doesn't make sense. If you are a patient accessing the healthcare system, or a public or a carer, the process can seem convoluted for no reason at all, and making it just difficult and challenging to access. And I also know that information is usually not given. I also know why it's often not given. That's usually, we talk about resource limitations and the lack of time, but it's also very jarring being on the other side and the patient, and you're not being told important information. And when I am, when there's a conflict or overlap of the roles, it's sometimes good to be a doctor and a patient. And sometimes it's better to just be a patient and not have people know that you are a doctor. And sometimes when that roles conflict or when there are problems, I've had to use the term professor to get me out of scripts, okay? Maybe it's to make it a little bit easier to access, or to have people listen to me. Sometimes just having introducing myself as professor or doctor actually helps with that. How about being a researcher and a participant? This is quite similar with you have similar issues. I also find that many researchers don't actually listen to what the participant is saying, or patient and public members. They just have their own agenda. They want to get on with the research, and they're not really interested in trying to make it easier for the participant, to recruit them for their data collection and so on. And again, sometimes the process of research often doesn't make sense. You're being told to fill in forms when it's not applicable to your situation as a researcher or as a participant. It sometimes doesn't seem logical. Again, information is usually not given to the participant. Yeah, not told in detail about how long this is going to be, whether there's going to be any issues with you not taking part. We give out patient information sheets that are important now, and you won't pass medical ethics without this, but quite often the language that I've seen that's being used in the participant information sheet, even I cannot understand. They use a lot of medical jargon, or long words with more than 4 syllables, and it's very, very difficult for a patient or public member who's not familiar with medical language to understand this. Sometimes good to just be known as a researcher and a participant. Sometimes it's better to just be a participant and nobody knows that you are also a researcher. And sometimes I had to use the term professor. For example, if I really didn't want to take part in a research, I would just say, oh, I'm so sorry. I just have to go for a supervisory visit, meeting with my students. I'm Professor Liu in this, and can make my apologies and go on my way. So similar, being a doctor and a patient, being a researcher and a participant. So why do all these problems occur? If you examine it, the root cause is probably the power differences, or the power dynamics that's occurring, where the doctor or the researcher is seen to be the big person, the important person, and the participant or the patient is seen to be, a token person. Even though they are the target of the research or the medical care, yet their views and their experiences are often not considered in the relationship. So there's a power differential that's occurring here, and that gives rise to a lot of problems. And is this problem possibly worse? I want you all to think about that. There is a Hofstad index. It was coined by Professor Gerd Hofstad, where it looks at populations and countries, and it finds there are 6 things that define that characterize a population or a country. And one of them is the power distance. Power distance is the degree to which the people at the lower rung of powers accept that the people in power should be in power. That means they accept the power differences. They are quite willing to accept that those people who are in the higher rungs of society are meant to be there and have the higher power to make decisions. So this is particularly relevant in Asian and in the Middle East. And so what do you know? Malaysia has the highest power distance of any country in the world, a staggering 104 on the Hofstad Comparative Power Distance Index. We are top. We won the thing, which I'm not sure is a good thing, because it means that we're very accepting of these power hierarchies. And therefore it continues, and that, patients accept an authoritarian doctor, and participants accept that researchers have power over them, are able to, do not take into account their views and experiences in the research. So what can be done? What can we do to ensure that this important group of people, the patients and the participants, which are the target of our clinical practice and the target of our research, that their views and experiences and their needs are taken care of? So in clinical consultations, in clinical practice, there is a concept known as shared decision making, where any medical decision that's made is made between the doctor and the patient. This is to ensure that patient has autonomy over the medical care that they are receiving. And it even goes on to patient-centered healthcare system, like what we are trying to do in the Faculty of Medicine, University of Malaya, patient-centeredness. In research, though, there is a movement known as patient and public involvement in research, where again, these power differences are leveled off, and we involve patient and public members, not as participants, but as members of the research team. And if we are really going to be a patient and public-centered Faculty of Medicine, where we do a lot of research, then really this is an approach and a concept that we have to embrace to ensure that we are truly patient and public-centered. So how do we do this? What is PPI? So let's start at the beginning. PPI stands for Patient and Public Involvement. And in this case, it stands for PPI in research. So it's not the traditional way of doing research, where we do research on a group of participants, or we do research to a group of participants, but rather we do it with them or by them. There are actually some research that are led by patients and members of the public. So you can see that, that the research team is not just going to be healthcare providers, policymakers, therapists, clinicians, nurses, and so on, but also include patient and public members. And they are equal partners in the research team. And people do often misunderstand PPI. I must admit that when I started in this, I thought I was taking into account patient and public views and experiences. After all, I did a lot of qualitative research and I was interviewing them. But that is not patient and public involvement. That's just interviewing patients as participants in qualitative studies where we will ask them the questions that we had already decided on in the project planning. It is also not just telling participants the results of the study. It's not just sharing protocols and report with stakeholders. And it's not doing things for the good of the patients and public without taking in their views. Right? Quite often I hear researchers saying, oh, I know what they're going to say, or I know what's good for them. I'm more health literate than the patient or the public, so I know what's good for them. And that's a very patronizing and authoritarian kind of view. So it shouldn't be one direction, rather it should be bi-directional, where it's not us telling the person what to do or making the decisions, but rather the patient and the public members also participating in the discussion and planning and everything else in the research process. So it's multi-directional. And really, this phrase actually encapsulates the thing. Nothing about me without me. And this was coined by, I think the person is Valerie Billingham in 1998 at a conference. And it was said in terms of patient care, there should be no medical decision about their care without the patient's voice. But it's the same thing. It's nothing about me without me. If you're going to do research on, for example, asthma, it is also important to ask the patients and public members about their views and how they think that the research should be carried on, and whether in the first place we should look at that research question, because this is all about them. Nothing about me, without their participant, patient, or involvement. Why do we need to do this? Is it just a Western concept that we are trying to, embrace so that we can get funding and that we can get published? No, there is a moralistic reason for it. Research is meant to be for the patient and the public. After all, most of our funding is from public funding. It's through taxes and through their labor. So they should have a say into what kind of research is being done and how it is being done. And patient and public involvement has also been found to improve relevance, meaning that they research, when you have PPI, the research is more likely to answer questions that are actually important to patients, rather than research that's not relevant to them. So for example, the use of steroids in prophylactic steroids in asthma. I mean, we take it for, it's for granted because we know that the guidelines say that we should use prophylaxis when the asthma is not controlled. But what about the fears about the side effects? Often doctors just don't think about side effects. They just say it just goes to your lungs and not everywhere else. But patients and the public members are very worried about side effects. So we should do research on this. And also it helps in research implementation in terms of things like study design, what quantitative, qualitative, mixed methods, how we recruit patients. In terms of documents, so for example, patient information sheets, informed consent, are they understood by the patient and the participant and the public member? Are they written in a way that's clear so that they know exactly what they're signing up for? In terms of data collection, how to get the data and interpret it, and in terms of dissemination of the results so that it gets to the people that it's meant to be for. And so now I want to tell you about the example of patient and public involvement through our research. We received research funding under the National Institute of Health Research, and Respire was funded by the NIHR. It's a global health research unit that focuses on improving respiratory health in Asia. And there were 4 countries involved in this, and the 4 countries together with Edinburgh in UK, and the 4 other countries were Bangladesh, India, Pakistan, and Malaysia. And one of the platforms was on patient and public involvement, so that all the research needed to say how they did this and think about how to involve the patient and public members. And the Malaysian principal investigator, as well as the one in charge of the chronic illnesses in Respire, was and is Professor Khoo Yi-Meng. So she is the principal investigator for this very large project. And I'm going to share with you some of the results of the work that I did in developing patient and public involvement in research in Malaysia. And some of the slides were presented at our annual scientific meeting in November last year. So I got a fellowship. I was very lucky to get a fellowship. This was in 2019 when I wrote in and applied to do a fellowship under Respire to look at developing patient and public involvement in Malaysia. So I do have a conflict of interest. I am really interested in developing PPI in Malaysia. And this started in 2019. And so these were my supervisors. They included Hillary, Tracy, Prof. Khoo, and Alison. So this were my really fantastic supervisors, some who were in Edinburgh, and of course Prof. Khoo was here in Malaysia, who really guided me along in my fellowship. And in the start of it, I had to learn about how the places in UK, Europe, and other countries involve patient and public members in their research. So I wanted to see the role models that were already present. So I attended the European Respiratory Society Congress in Madrid in 2019. And at the start of their Congress, they always have a patient networking day, where they bring patients and public together. And it was really remarkable because it was abstracts of research that was led by patient and public members on lung conditions. Really, really good to see what was important to them and how they carried out the research. And I also met with people who had worked with in PPI in Edinburgh, and this is a patient member, and I interviewed them to find out what were the facilitators, what helped, and what were difficulties that they went through by getting involved in research, and how we could actually do this in Malaysia. It was fantastic. They were really welcoming. They felt that this was a good idea to start anywhere because it gave them a voice, and they felt that they really made an impact in the healthcare research, that they could see the impact of their involvement. I also sat in on a PPI discussion group in Keele University, and this was the fantastic group that I sat in, and I found out how they actually, they were showing a questionnaire, and they asked the patients and public members what they thought about the questionnaire, and they were really critical and gave very, very good feedback on how to improve this. It was excellent. So what did I decide to do during my fellowship? I wanted to do 3 phases. One was that I was going to look at the evidence and perhaps do a scoping review on patient and public involvement in research in low and middle income countries. The second thing was that I was going to do a local case study using Respire as an example. And the third one is that I was going to interview patient and public members and researchers and policymakers to see what they thought about PPI. So I had to change this a little bit because there were a lot of scoping reviews that had actually been done and were being conducted. One exactly with the title of PPI in research in low and middle income countries. So, I wasn't going to repeat and do duplicate work. So what I went on to do was to look at the written research guidelines of our 4 Respire countries and see whether there was anything about patient and public involvement in the guidelines, in their research guidelines. For example, their Medical Research Council, did they write anything to say that there should be patient and public involvement like there is in the United Kingdom, in the United States, and in Australia, and in a lot of European countries? So do we have something similar here? And what I found was that there was nothing written about patient and public involvement, no recommendations about this in the written research guidelines. So there is obviously a gap, and that's something that we need to do to decrease this gap. Then I also, followed up on our Respire studies and helped with the patient and public involvement. And we had a really good group. We had a core PPI group of 5 members, and they're Mr. Subramania, Puan Saiton, Puan Haji, Encik Ahmed, and Puan Hamida. And they really helped us a lot with our research. Some of the activities that they did was they looked through our documents that would be the ones that would be seen by the patients, the face documents we call it. And then, they told us to correct our language and to make it easier to understand and to ensure that the patients really knew what they were in for. They spoke to us about the data collection process and how we could recruit people, and also helped us in the analysis of the results to see whether this was valid and relevant, and also very importantly in the dissemination of the results. We met is about 3 times in a year, and the way that we did this was that we had a workshop in the beginning where we recruited them, and then after that WhatsApp was the preferred mode of communication. They were the ones who came up with it, and they said, let's just communicate by WhatsApp, and you can tell us when the meeting is, and we will tell you when will be a good time and place to meet. And then the part 3 was the in-depth interviews where I did the qualitative studies. And these were the teams that came out. I interviewed both patient and public members, and some of them who had experience with PPI in Respire, and some who didn't, and also healthcare providers and researchers. So these were the things that we found. So in my opinion, this is very good. Respire doing research that's involving patients is really good because this has impact. That's better, more direct, really good. And then another participant said, naturally, the one who knows more about the illness is the patient. And you can't deny that, right? And another participant said, PPI is important. Yeah. And it's only in Respire that involve patient that I can see a two-way consultation. Before this, in the groups, patients' views were not involved, but I can see that when they are involved, it's great. And this was by a researcher, so it was fantastic. And these were the facilitators to PPI development given by both the PPI members as well as the patient and public, and also the researchers. And they said that it's important to carefully select the PPI members, not to select the ones that will agree with what we say, but the ones who are easily approachable, like to work as a team, and who can share their ideas and opinions. And I think this is really important because it is important that we get the people who can voice out their views and can work in a team. And they also said that you needed to see a continuing relationship so that they can see what their role is and what is the impact that they had on the research. So we also need to show them what comes out from this PPI. I think once we have got, once you do the research, right, and then we involve them, and then we have to show them what was their role, that it plays importance. And this is really, really useful because it shows us that you can't just involve people at one point in time and expect that, they feel good about that. They would feel happier and more satisfied if they knew that their role and the time that they spent actually had impact on the research. It was also important to consider the accessibility of PPI members. And that was an issue because sometimes it was difficult to get people who are working, who are young, and that might be the group that we need because they might be the one that we need to access care. And really during the time of the COVID thing, it was really difficult, but we could do some interviews by just using videos, but it just did prove difficult to reach a group of people who were not familiar with technology. And then we found out there were barriers, and these were the barriers that were perceived by patient and public participants. For example, they felt that if you were unable to speak English and Malay, there will be participants who will not want to take to do the patient and public involvement. And that's really, you can see that from the second quote here. Let's say you are the professor. You must have somebody else who can understand him better also. Sometimes an Indian person or what can't even talk a little bit English or a little bit of Malay. So you must have a person there who can talk to him, communicate with him or her. That's important. Low educational levels, that this were patient and public members who felt like, they will feel shy because they are not highly educated. So it's really important that when you have a PPI group discussion, not to make them feel small or unimportant, because actually they are the experts in their condition. They have been the one living with their illness. Also, those who found it difficult to access the meetings, for example, who had time restraints and difficulty with travel. But the researchers and policymakers felt that there were other difficult barriers. For example, a lot of researchers felt that there was a general lack of awareness and skills regarding PPI. So they also had uncertainties about research policies. They didn't know whether it was okay with ethics or with funding agencies. And also because they had limited funding, and you can't just ask the PPI member to come for the meeting without paying for their travel allowances or even their time, an honorarium for their time. So these were important things to consider. And actually in the UK, the patient group involved that deals with PPI involvement do have a calculator that calculates how much a person should be reimbursed for spending time with doing patient and public involvement in research. So as you can see from the quotes, maybe we are not skillful enough to handle the PPI session, and if the patient goes away from whatever the main discussion, so we lack the skills. And then the communication part, there will be a barrier. With our work constraints, we can't just be like focusing them, getting them into consensus. And some of them, I think, don't even have email. So the communication is quite different. And for me to handle that, I think it's a bit difficult. So really, I think Respire has taught us very much on how to actually, make PPI feasible and possible. So there were some recommendations that came out too. They felt that there should be training on PPI for researchers, and this is part of the outcome that we want, that I gave a talk at the research carnival so that we can tell you a little bit and that you will have a better idea on how to do PPI in your own research. There was also a need for development of policies for national research funding and approval, so that researchers don't feel like, do we need to get informed consent for PPI members? And will the ethics committee agree for us to have a PPI discussion before we even have ethics approval for the research? The short answer to that is yes. So because they are part of the research team. And then they recommended use of a successful case study so that people will be interested and will actually do it, like Respire. So I think before we jump into all this, we should have some guide or training how to handle patients during the engagement session, because there will be a lot of things that will be brought up, and this affects us as a policy maker. And there were some researchers who think that an academic institution should be the one to drive this, because we can then work out the difficulties and make it easier for other researchers to follow. And so we are hoping that University Malaya can be the one to drive this. So here's the plan that we came up with for developing PPI in Malaysia. So there are 3 levels. First is the institutional level, and we already started discussions with hospital and faculty to develop a strategy for PPI. We've already incorporated it into our training. We run online module on how to write a manuscript, and quite often now journals ask you, how did you involve patient and public members? And it's a mandatory thing to write a statement on this. And we, in our workshop, we actually discuss this and give you all tips. And it is also, one of the things was also to disseminate this by making it the theme of the Faculty of Medicine Research Carnival, as we are doing right now. At the national level, we are trying our best to meet with policymakers from the Institute of Clinical Research and the Deputy Director General of Research, who's in charge of research. These plans had to be delayed for a little bit because of the pandemic and the fact that the Ministry of Health has been really busy trying to combat this. At the regional level, it's important to think about how to disseminate this more globally. And we are thinking about including this as a policy in our index journals. For example, I'm the chief editor of the Malaysian Family Physician, and I am hoping to make PPI a theme for our journal next year. And we also plan to collaborate with other countries in this region in research and introduce the concept of patient and public involvement. So the take-home message is, do PPI, but don't just do PPI just to say, for the sake of it, don't just do it just to say that you've done it, all right? Because quite often that's used, like virtue signaling, that they say that, oh, we have included patient and public members. We are so brilliant. We are so good. And so again, this was a picture drawn by a patient member at the Cochrane colloquium. And that this can be a problem when PPI is made mandatory, that people do it just for the sake of doing it because it's mandatory, but they are not actually reducing the power differences. As you can see over here, the researcher or the doctor is still the big important person, and the patients are put in a box and they're made very small and have, almost no impact on it. So please, whatever it is, let's not do this, okay? Why is this important? I mean, again, let's go back to the root cause. The root cause is the power differentials. So Sherry Einstein was a person who wrote about citizen participation in her seminal work very, very early on. And she wrote and said that citizen participation, and citizen refers to a patient or public member, is actually another word for citizen power, this PPI, because it's the actual redistribution of power that ensures, that enables those who have not, those that are presently excluded from political and economic processes, to ensure that they are deliberately included. And we have to think, she wrote about the 8 rungs of the ladder of citizen participation. And you can see over here that that we are probably over here where it's non-participation. Malaysia is over here where we manipulate or we just decide. So we give a therapy to the citizen. We are the one who does that thing. Or perhaps we are at the degree, just, token degree, where we inform people about what the research is, like giving them a participant information sheet. Here, sign this, or we consult them and then we think, maybe we'll include that or maybe we won't. Or we placate them, we'll say, okay, if you want to take this, then I'll give you a biscuit or a pack or something, or some money to placate you. But that's not true citizen participation. When we redistribute power, we want to ensure that they have a true say, so that it is a partnership. And a partnership means that their views are considered to be on equal standing with the other members of the research team. And sometimes even higher than that, we delegate more power to them so they can direct it. For example, in the UK, there are citizen participants who sit on the funding committee, and they are the ones that have an important say into whether the funding goes through for a particular research project. We have nothing like this here. And that's quite, to me, that is still, that is still lacking, and that is not good, because we should do research that is relevant to patient and public members, not just research that is relevant to us as researchers. And finally, the highest rung is when the citizen or the patient or public member has control, as it should rightfully be. So let's get up there, okay? But let's just take the first few steps first, okay? And so, it's not good to give a talk without involving a patient and public members. And I really wanted to get our patient member to come here and talk to you. And I had, she had agreed. And so Puan Hamida is the patient member here. And she's a seamstress who works in Klang, and she's an asthma patient. And she is she's been a member of our core PPI group for the past 3 years. And she also is a co-applicant for one of our next research funding. So she is, she wrote a statement on why she thinks that this is is important to involve patient and public members. And she had agreed, but unfortunately, because of the pandemic and also the fact that she has not enough data, we were unable to record her and do it on video for the purposes of this. So you can see the barriers that we have in doing real PPI. But I'll show you the letter that she wrote. And this is what Puan Hamida wrote. Puan Hamida wrote about her I have a permission to show this, that she's 45 years old. She has had asthma for almost 40 years, so almost all of her life, and that she has gone through all sorts of experiences, and that she's still receiving treatment for this. And she has worked with Respire so that she can contribute, and she's being humble here by saying contribute a little. She has contributed a lot in terms of her experiences and views as a patient. And she's convinced that patient involvement can be emotionally helpful to her in dealing with the disease. And she wanted to also get more knowledge about the process of research and to ensure that her voice and opinion is included in this. And that the project she felt was very important for patients and for the community, because it can help ensure the improvement of treatments and increase awareness of patients. So she strongly supported this, and that she was convinced that it would have a positive impact. But Puan Hamida didn't write this in English. This was the translation that we did, so that the people in NIH could understand what she had written. This is her actual letter. And we included this to show that this is what she said. So you can compare our translation and see whether you think that we were faithful to the original. We showed her both both copies, and she agreed to the translation. and we use that in our research application. So it was really, it's been a great journey, this fellowship, in learning how to involve patient and public members in research. And I must say, I've learned so much from them, and I've enjoyed every step of the way. So I want to thank you again for giving me this opportunity to share with you my experiences. I have had a really good time with this, and and any research that I do now, I intend to involve patient and public members, not only because it's right for them, also because they really make the research process so much better. So I hope that you too enjoy your journey with patient and public involvement in research. Thank you very much, and thank you for listening to me.
Thank you very much, Prof. Liu, for such a holistic sharing.
Hello, I'm Professor Dr. Liu Sumi, and I'm here to talk to you about my experiences.
Sorry about the technical error. Well, again, we would like to thank Prof. Liu for such a holistic view on PPI. And to our researchers and our clinicians, please bear in mind that PPI is not just for the sake of grant application or formality, but it is the aim and the outcome is for the betterment of our patients and our participants and the general public. And as for the public members, our participants and the patients, please, like Prof. Sumi say, take control of your voice and give out opinion and feedback so that we can deliver a better outcome for all of you. And remember, the one is living with the disease is you. So feedbacks all around, and that would be great. And we do have a lot of questions from the public, from the audience. And thank you so much for all the questions in the comments. And don't worry, we will definitely send all these questions to Prof. Liu. And hopefully by the end of this week, we'll get the recordings onto FOM Facebook page with the questions that you all have posted and also the answer from Prof. Liu. And Prof. Liu, if you're watching this, we hope that you will have a speedy recovery and you'll be back on your feet in no time. So that is the end of our morning session. But to the audience, please bear in mind that we do have another session. So every day there will be 2 sessions for this 4-day carnival. So the next session will start at 3 today. And as for the next session, we are going to have Prof. Julia, and she will share some ethical conundrum and also challenges in implementing PPI in research, education, and advocacy. And following up after Prof. Julia's talk, we're going to have Professor Sir Terence Stephenson, and he is the chair of Health Research Authority of England, and he will share his experience and challenges in PPI in implementing PPI in research in England, and we can learn a thing or two from their experience and apply it to our settings. So with this, thank you so much for joining us in the morning session, and we will see everyone back at 3 p.m. today with a new link. Thank you.